most rewarding things that I hear every single day.
Yeah.
It's like everybody notices that once their jaws are opened up and they're breathing better, sleeping better, it's like that anxiety is gone. Welcome to the Alfi podcast, episode number 39. Today's a special treat because we have Collin and Rebecca, who both had jaw surgery, but it gets deeper than that because Rebecca is an airway specialist herself in the healthcare system, former dental hygienist, now myofunctional therapist and airway advocate.
Yes.
And she speaks all over the country on Airway. Her husband also had jaw surgery. So this is a family of blue oceans, and we'll talk about that. And we'll get a very unique perspective about all aspects of this. Wife, son, mother, husband, daughter, all of the above, and practitioner. So a lot of pearls and gems. You're not going to want to miss this episode. So let's start with, who should we start with? Ladies first, I think.
Of
right?
course.
Always ladies first. Rebecca, thanks for coming to the studio.
Us. Yeah.
So you're not from Texas.
I'm not from Texas. We moved to Utah 2 years ago from Seattle. So that's where our airway journey began, was in Seattle. So.
Yeah. So I know that when you started as a dental hygienist, that airway wasn't a thing.
No.
And this is a common theme for, if you watch any of our podcasts, this is always, you didn't learn airway.
No.
In training, but through opening your eyes and practice and seeing things clinically, and then once you see it, you can't unsee it.
Exactly.
But what was that journey like for you?
There were many days where I wanted to light my hair on fire because I couldn't figure out how it wasn't so obvious before. When I started learning about myo and the airway and what the things that I would see clinically every day, and I saw in my own family what it actually meant. Yeah. And the fact that my family struggled in ways that they didn't need to. Yeah. And so that was, like every other person's myo experience or airway experience, when you realize there's a solution, it's very emotional.
Definitely.
Yeah.
Yeah, you think about all the things you've missed.
Yes. Especially as a mother and a practitioner. Yeah.
Where did you first see it? Was it as a mother, as a wife, or is it for yourself?
As a wife, I'm the one that identified my husband's tongue tie when I was in college. We were in our mid-20s when we got married, and he was my obligate patient, of course.
No, of course.
And I identified his tongue tie, and it was the coolest thing anyone found in clinic, and everybody wanted to see it, but nobody assigned any meaning to it. It was just a variation of normal. But looking back at the things I had known about him, as relayed through family stories, it made sense. Yeah. And so I can see where he struggled from a very, very young age and continued to struggle as an adult, as a husband, as a father, as an employee.
And did it get worse over time?
It did. Yeah. Yeah. He was essentially a zombie.
Really?
So if he wasn't working, if he wasn't moving all the time, he was sat still at all, he would be eyes closed and not, or even eyes open and not engaged at the dinner table. Yeah. So. Yeah. It's frustrating. He was on fumes for sure.
Yeah. And this is interesting as I look at you and I hear, and I know your husband. Yeah. None of you are the picture of sleep apnea.
Right.
Right. Yeah. Young, healthy, fit, active.
Exactly.
A fighter. Educated. It's like nobody looks at any of the three of you and thinks there's sleep apnea there. And that's what's taught.
They don't be on the surface.
Well, they thought it was about anything but sleep apnea.
Correct.
It was ADHD, asthma. You go down the list and it was none of those things.
Yeah. Right. And this is like the most exciting for me to share is these stories because it's so relatable. Yeah. It's like everybody, if it's not them, it's someone very dear to them.
Right. Yeah. Yeah. And then subsequently, he was my first child, and he had issues that he struggled again with the ADHD and mouth breathing. I didn't know it meant anything, just had bad breath all the time. I'm like, what are you doing?
Right.
Yeah, it was a post-nasal
drip. That was my biggest worry.
Of course, the dental hygienist, like, are you brushing? Yeah, yes. I know you're brushing. What's going on?
Yes. Yeah. So we thought it was allergies and post-nasal drip. We tried to fix all of those things, and nothing helped.
Yeah.
And my younger son, I knew 3 days after he was born that he was tongue-tied.
Mm-hmm.
And there still was no real meaningful help. If it didn't affect his speech, nobody was really concerned. Right. So we struggled like all, mom, baby dyads do. We struggled through it. We got it done what we could as long as we could. And he grew up to be a very anxious child, a very temperamental child. And I came into my myo education when he was 17. So my kids were grown when I figured out how to help them.
Yeah.
And I had a lot of regret thinking of the things they struggled with that I could have helped them with that I know. But you have to let that go.
For sure.
Do the best you
got to
can
move
with
forward.
what you know at the time.
Yes, absolutely.
And so we had his tongue tie released pretty quickly after I learned about myo. And it really did change his demeanor for the better.
Right away.
Yeah. Yeah.
That's amazing.
Right away. Like
how
that
old
day.
was he?
He was 17.
17 at that time.
And he had sometimes debilitating anxiety in social situations that he still kind of struggles a little bit with, but not to the degree that he did.
Yeah, definitely improved.
I mean, he's much more patient now.
Yeah.
Much more. Like, you can't get to the end of that fuse as quickly.
Really?
Things just used to set him off so fast, and now he's much more just mellow
Chill.
about everything.
It's amazing. I think anxiety for me is one of the,
and these are
or so much better.
These are family issues, right? Like these dynamics affect every important relationship in your life.
Yeah. Yeah, definitely.
And the harmony in the home. And, it impacts a lot of ways.
Yeah. So that was going to get to that with both of you here. I'm going to skip to it and we'll go kind of backwards. Yeah. But I was going to ask, all right, Collin, mom had jaw surgery. How many months ago? 7?
August 2nd will be 8 months.
8 months ago. From that standpoint, like irritability, mood, changes in behavior, what have you noticed?
I mean, I've noticed it in both my parents, really. Just overall much more mellow. Like, I think for all of us, really, it's been easier to deal with feelings of anxiety or chaotic situations. It's not like we talk about limbic lockdown all the time, because that's something that we've all dealt with, is just being in chaotic situations, like in my line of work with construction and with the sales that I do now. I mean, it's a lot of things happening all the time, and it's really easy for me to just be like, oh my God, there's so many things happening. Like, what am I going to do? And now it's just way easier to kind of thoughtfully move through it. And it's been surprising for me, because those aren't things you would expect to be affected by Airway.
Yeah, that's interesting.
It's really fascinating, just the scope of things that it actually impacts.
Right. When you think about that, it's like, how many times have we heard in our life, if you're anxious or, overwhelmed, like, what does everybody since the beginning of time tell you to do?
Just
like,
breathe.
Just breathe.
Take a breath.
Take a breath. So it makes all the sense in the world.
Stupid,
and then they go,
right. So it's like, it makes sense. And now that you can breathe better, it's like, that's automatic, right? You just, your nervous system is more relaxed and you don't feel as overwhelmed.
Yes.
And the tongue posture comes with it. The myofunctional therapy has really helped with the tongue posture. And I didn't know how much that nerve stimulation helps.
Yeah.
But since then, I've made a couple friends that were in the Marine Corps, and that's something they teach you in the Marine Corps.
That's interesting.
For dealing with high stress situations, is that tongue posture, breathing
Oral
mechanism.
It's amazing.
Yeah.
That shouldn't be a Marine secret.
It shouldn't be. No, it's like, why aren't they telling everybody about this?
Right. Yeah. Rebecca, from the men in the house, mood, irritability before and after.
Yeah, they're all, he's always been pretty even keeled, but he was my one that would always forget things. Okay. I told him I was going to put it on his tombstone. That's all I ever heard of him growing up. But the temperaments are a lot more even keeled. Like you said, the ability to deal and cope with stress.
You notice that?
Yeah.
Yeah.
Yeah. My husband is much more engaging.
That's awesome.
I wouldn't say necessarily more energetic.
Right.
But he's able to keep up with what's going on in the room.
Yeah. Not zoning out as much.
Because I would never say that he was really irritable, but it was more that he just lacked the bandwidth to deal with things as he can now.
Yeah. Do you feel like that's affected all y'all's relationship with each other?
I think so.
Yeah.
We've always had a pretty tight-knit family anyway. But I think there's an ease about us now.
Yeah.
Collectively.
Definitely.
That's nice.
That makes being together even more enjoyable.
Yeah, that's nice. Well, one of the bluest ocean households in the country.
That's probably true.
Right. We took both your scans.
Yeah. Yeah.
And they're both wide open blue. We'll put them up on the
They're
podcast.
massive
And
now.
people will have airway envy.
Yeah.
Oh, we surpassed my expectations by a landslide.
sure.
So.
I have airway envy.
Well, I know where you can get some help.
Yes, tell me. That's great. All right, so let's go back. We're backtrack. So Dad went first, right? What was that process like? Was it?
Well, he had severe sleep apnea, obviously, and so he was, for me, the most crucial.
Yeah.
I didn't know at that time that I was going to need jaw surgery.
Right.
In fact, I thought that I was probably going to be able to avoid it. I just didn't really see it in my future. But
That's right. You said that earlier today when we were talking, is that you didn't even know that you were an airway patient.
I would not have categorized myself as an airway patient. My journey started, not to avoid my husband, but my journey started with TMJ issues that I've had since I was in my early 20s.
Yep.
And the rule of thumb then was, if it's not painful, then just leave it alone. Here's a night guard.
Yeah.
Which I didn't do well with. But I knew that something didn't make sense. It wasn't right. And so I would always ask, I would, keep trying to learn and figure out what was going on. And again, once I developed my myo education and knowledge, I realized that my TMJ was never going to be stable if I figured it out on my own, that I was posturing my jaw forward. Nobody saw it. It made my bite look really good.
Yeah.
And I think that developed from ortho in the 80s with headgear and elastics. I think it didn't really move my teeth as much as it just taught me to posture forward.
Right.
And so I was functioning forward for, a couple of decades.
Yeah.
And,
putting stress on the joints.
And then I had displaced discs and noisy joints. And it was almost impossible to eat with company because my joints were so loud. So, and now they're still, they're not fixed. I don't have those discs back, but they're much quieter.
Yeah.
And not clunky. I mean, it was like a clunk, clunk.
The symptoms are much
my jaw
better.
was going to fall off.
Yeah.
Yeah. So much more subtle.
Yep.
Well, it was audible. I mean, every time we ate anything, you could hear
Really?
that jaw popping, and I haven't noticed it at all since.
That's
surgery.
awesome. Yeah.
Yeah. No, and I know it's because my jaws are now in a harmonious relationship,
Right. Yeah.
not just the teeth.
Right. And not having to hyperfunction at night to keep your airway open.
Right. Which I didn't know.
Which you didn't know. Yeah. So when you said that, what did that mean? Like, you notice now you can breathe in ways that you didn't.
Yeah. So, well, of course, as part of my surgical preparation, I had a sleep study, and they did find that I had mild sleep apnea. So that kind of clicked to me because I've historically never been a morning person, and I just thought, I'm just not a morning person.
Right.
Right? You have morning people, you have not morning people. So,
Yeah.
but for me, mornings were drawn out negotiations with myself 5 minutes at a time. Just 5 more minutes.
It's hard to
just
get out of
5 more
bed.
minutes.
Yeah.
Overwhelmed from the minute my eyes opened. Just wanted to just go back to sleep.
Hit the snooze.
I just need 5 more minutes.
It's like pulling yourself back from the dead every morning.
It is.
Yeah.
It was physically. I would tell people it was physically painful.
and
now I wake up 5:30, 6 o'clock without an alarm.
Amazing.
You wake up, you're blurry eyed, but I'm ready to get going. I get out of
You're
bed.
not negotiating anymore.
No negotiations. And my husband, he's a military guy. He pops out of bed like toast in a toaster, right? Like,
Amazing.
and we would talk. We're like, I'm like, how do you do that? Like, he goes, well, how do you do that? Like, it's torture. And it was, like,
Yeah, it's not pleasant.
Yeah. So it's just interesting. So now I can get up and I get going, and I have better stamina throughout the day too. I'm not looking for my 3 o'clock coffee.
Yeah.
Not that I felt like I ever needed to like take a nap or anything. I
Right.
just would hit a wall and I would just get that kind of pull. So
Yeah.
And
That's awesome.
I can get through the day.
I've almost cut coffee completely out.
Yeah.
Like I might have 1 cup of coffee now, but not
Really?
even every day. And it used to be like I'm drinking a pot of coffee every single day.
Yeah. That's amazing.
Yeah. So yeah, it turns out I was an airway patient.
Yeah. And I think that's, a lot of people don't realize it because it's just not, the information is not mainstream.
Yeah.
And it's almost like our society's addicted to caffeine.
Yeah.
There's energy drinks are billion-dollar companies. Obviously, coffee is a drug of choice for most.
Yeah. And one of your podcasts, you said every TMJ patient is an airway patient.
Yeah, I believe that.
Raise my hand.
Right?
Raise your hand.
Yeah.
Yeah. That's me.
Yeah.
So,
Well, and there's definitely noticeably like very little focus on airway because even in my process trying to get, I guess, decide if I qualified for this sort of surgery. None of the tests we did, they were looking for an airway obstruction or a lack of airway. It was looking for everything else. They tried to tell me I had narcolepsy. I mean, we went through everything except for airway dysfunction.
Yeah.
And that's exactly what it was.
Yeah. This is an interesting thing.
I was already pretty convinced that apnea, and they said narcolepsy. I said no. That's when we came to see you. Like, no.
Yeah, they were like, naps are going to be your best friend. I'm like, but naps make me feel like crap. They're not my best friend. They're my worst enemy.
Yeah, I mean, narcolepsy, it's like, okay, you want to fall asleep, you're tired.
Yeah.
I mean, if you're not sleeping well because you can't breathe, that's going to be classic for everybody. So it's like, first and foremost, before anything, they got to look at airway. And hopefully we get there.
They kept him for 22 hours.
Oh, that was a long day.
Oh, really?
Yeah, 22
trying to get you to nap more?
Windowless room. Yeah, it was the full night, and then it was like 12 naps throughout the day. All this different stuff. It was wild.
Like torture.
As a punishment.
Right.
I was delirious by the time I left.
Really? Yeah.
Like, I don't want to sleep ever again.
Right? Yeah. I was going to say, you asked about, breathing in ways that I hadn't been able to before, and that's true. So we told you today that both of us were diagnosed with exercise-induced asthma. I used to because I was allergic to exercise, right? But now I can exert and I don't have any of that spongy, wheezy, coughy, feeling like I have to clear my throat all the time, which I now, I didn't always recognize as asthma symptoms, but now I realize they probably were.
Right.
And then after exercise, I always had that like spongy feeling in my chest, that crackly, wheezy sound.
Oh, the recovery now is, just easy.
Yeah, that reactive airway, like cold air, we used to make or a cold drink would make my lungs spasm. I don't get any of that anymore.
Yeah, that's good being in Utah.
Yeah, because I like to ski, so it is.
Yeah, that's going to be a lot more pleasant. Yeah, it's interesting. It's interesting to me how many people we've seen with asthma that their asthma no longer exists after jaw surgery.
Yeah, it's really... it's really something, though, because it's supposed to work that way. I mean, we know, we've learned it. But to have it actually experience it and have it happen to you is
amazing.
Really, and it's just really justifies what I'm doing.
Yes. Yeah, that's a good word for it because you're the mother, the wife of this family, right?
Yeah.
And you've had pretty much the entire household go through this airway journey, and that's a very brave thing to do. I always admire people like you, patients like you that spearhead this for the family because it is not mainstream.
Right.
To this day, despite this podcast, despite everything all of us have been doing for outreach, most providers, most people will look at you and try to talk you out of this.
Right.
And if they say, oh, you did it, your husband did it, your son did it, they might think you're crazy.
Yeah. Maybe she has Munchausen's.
Right. So
you do get some looks and some judgment.
Yeah, it's real. So when you say justified, I think that's the right word.
Yeah.
For it. And I think that all the naysayers or everything they say is not going to age very well.
Right.
At all, because I think this stuff is coming to light.
Right.
And that was definitely part of the difficulty starting this when, like, going to my primary care in Port Angeles and trying to get this started. And they're like, well, why do you think that you need that?
Yeah.
I'm like, well, because my mom was giving me some information that I've been reading up on. They're like, what does your mom do? I'm like, she's a myofunctional therapist. And they're like, oh. Like, they just did not take it seriously at all. It's like, okay, so I'm going to kind of have to, like, make this happen. They're not.
Despite that.
Yeah, they did not want to do the sleep study. It was, like, just a huge process to get them to actually take it seriously and do the sleep study and do the blood tests and do all this different stuff. And
I like that you're on that note right now. So you saw both your parents go through this. At what point did you think, okay, I want this?
Well, and so it was an interesting process too, because I saw how it affected my dad, and it was like we were talking about earlier. Like he's mid 50s now, and he looks younger now than he did in his 40s. Like it's clearly impacted his life so much. And for me, I didn't really understand the gravity of how serious the dysfunction was for me because it's been like that my whole life. I've never known anything different. But seeing how positively it affected his life, and then with my mom getting into myofunctional therapy, and she's telling me about all this stuff, and I'm reading up on it, doing my own research, because I'm not just going to be like, okay, my mom said I'm going to do it. I'm going to go get double jaw surgery.
Right.
Like that's kind of a big step for me.
There's nothing wrong with that.
That was a big step for me because I'd had my wisdom teeth removed, but never had any real surgery.
For sure.
So that was a big thing for me to do. But reading a lot of other people's experiences with doing this as an airway focused thing and not just as a cosmetic thing.
Right.
And part of my hesitation at first too was going to see if I could get pre-approved with my employer's insurance. And they said that it was a cosmetic event. And so I had to jump through tons of hoops to get approved. So this isn't worth it. And we ended up dropping that and going with my dad's insurance because they were treating it as a medical thing. And it's a totally different, and I've spoken with other people that did the same thing, but back in the 90s, and they're like, they told me it was a cosmetic thing. And so they basically covered none of it.
Right.
And so many people benefit functionally to such a huge degree. And it's affected so much more of my life than I anticipated. I was like, I can sleep better. That's going to be cool. But it's like, she was saying my memory was horrible, but it's now I'm getting REM sleep. So I'm able to do that mental process to retain memories. And I mean, my energy is better. My attention, my ability to focus is substantially better.
It's amazing. I mean, you're only 3 months.
It was from day one. It was a substantial.
You can feel it.
You could tell. And I never really had dreams since I was a little kid at all. And now it's like every night, these just vivid, really intense dreams about foods I can't eat. But
You can't
until
now.
today.
And now until today,
It's a big day. Colin got cleared
off
today for the first thing he did after an hour. We visited this morning. He went to barbecue.
Yep, that was
Texas
worth it.
barbecue.
Now on to chicken wings. That's what I've been dreaming about the most. is chicken wings.
We'll do it. Rebecca, back to you.
Yeah.
So, how has it changed you as a practitioner?
So I'm more willing to talk to patients about the possibility of jaw surgery. And I advocate with my referral partners to not be fearful of
Surgery.
bringing it up with their patients as well. Because it's that thing in dentistry that we avoid talking about. We know that's what they need.
Right.
We know that's
but nobody wants to go there.
Nobody wants to talk about it.
Yeah.
So I'm trying to destigmatize it because in my experience now as not only a practitioner but as a patient is the procedure itself to me isn't any worse than surgical third molar extractions.
Yeah, I hear that a lot from people.
Yeah. The challenge is the long drawn out recovery.
Correct.
It gets old. It's not hard necessarily, but it gets
It's
old.
a process.
Yeah. I think I put some referral partners and some, contacts that I make that way a little bit back on their heels because I am not afraid to discuss it.
Yeah.
I'm not afraid to put a client on the path to get information and make that decision on their own.
Yeah, definitely. Yeah, because it's still not.
Yeah.
It's still a big process.
Yeah. Yes, it is. It's not a decision you make lightly.
Right.
However, I'm not afraid to put them on the path to discovery.
Yeah, that's great.
Yeah.
That's awesome. I know you're going to give a talk soon.
I am. Yes, I am. I don't know if I'm allowed to say yet, but I won't announce it here. But I am going to be speaking in the spring.
Yeah, that'll be cool.
Yeah.
I think, and that's going to be a great group. Myofunctional therapists.
Speech therapists and myofunctional therapists.
That's awesome.
2-day symposium I'll say in Raleigh. Maybe that's clues enough, but
Yeah, that's awesome.
I'm excited about it. Yeah, so I'll be speaking about orthognathic surgery. And
for people that see my stuff on Instagram, I'm a huge advocate of myofunctional therapy.
Yes, we appreciate
and therapists.
That. Yeah.
I do really believe that you guys are so important, highly underrated.
Thank you.
Highly underutilized. And I think that there's going to be an explosion of myofunctional therapists.
We need them
as a career path.
That's been greatly useful in my recovery because that was something that she was like, we need to do this beforehand before you can't feel anything because you need to get this muscle memory down, get the proper swallowing posture down. Because that first week or two after surgery, you can't feel what's happening, but being able to swallow correctly was so helpful, keeping food from spilling out of my face because you can't feel your lips. You can't, it's really tough, but having that practice down was extremely useful.
Yeah.
For me, at least.
I can only imagine if all my patients had a myofunctional therapist in the family or at home.
Yeah.
That definitely makes recovery better.
Yeah. And I mean, even being in different states, we just do it over the phone.
Yeah,
do a video call. It's been super
over Zoom.
Easy stuff. It's really easy. And when you start, you're like, how is this going to help? And then a couple weeks in, I'm like, I'm noticing improvement. Even pre-surgery, I was noticing improvement in my breathing and it's so extremely useful.
I think even for people that don't consider surgery, start with myofunctional therapy.
Yeah.
And compared to other kinds of, I guess you could compare it to physical therapy. It's very non-invasive. It takes so little effort to do, but it's so impactful in the recovery and the pre-surgery kind of setup preparation.
Yeah. You were asking about how I practice differently. And I did this, it was before I had surgery. I knew that this more rudimentary swallow exercises were important for somebody in orthognathic recovery.
Yes.
But until I lived it, I didn't realize, really, that's it.
Yeah.
That's key.
How important it really.
Yeah, that's key.
Yeah.
Because there is a fear of choking. And surgeons not like yourself who still are banding people closed, and they're trying to swallow. That is very anxiety inducing.
I can imagine.
And I remember you came to the hospital the first day and you wanted me to swallow pills, and I was like, I don't think so. I don't know if I can do it. You're like, just try it. You had more confidence in me than I did.
Right.
And sure enough, I tried it and it was fine because I knew what to do.
Right.
I just had to stop and just think about it and just make it work.
Yeah.
But that was huge to be able to do that.
Yeah.
And I was saying earlier, the real game changers that I see that sets you apart from, obviously you have a unique approach, which shouldn't be so unique.
Correct.
But it is. And but aside from that, your post-op protocol is game changing, and I told you that.
Yeah, I appreciate
from the very beginning. To be able to move my face and move my mouth immediately,
that makes a huge difference.
Yes.
Yeah,
it is a measurably better recovery process compared to friends that I've had that have had double jaw surgery. Yeah. And coming back to work, 4 weeks after surgery, I went back to work, and everybody's like, "It doesn't even. Did you have surgery?
Yeah, nobody
where's all the scars and the bruising and the swelling?" And it's like, there's no way.
Yeah.
But then as everybody knows who follows you, your efficiency in surgery limits the amount of tissue trauma, which is obviously going to increase or decrease recovery time and improve recovery.
Yeah, I'll tell a story I haven't told on camera before. But I've told to every resident or fellow I've trained when they're assisting me in the operating room. I was a third-year dental student at Columbia, and I was externing at Harvard. And Lenny Cabin was a very famous Dr. Cabin, if you're listening. Hello. I've actually told Dr. Cabin the story.
Yeah.
So I'll end it with here. I know we got to go. So Dr. Cabin was doing a double jaw surgery, and I was a third year student, really wanted to get into oral surgery programs. It was, on my best behavior. And I was strong and working out every day, as I still do. But I think I may have been stronger back then when I was in my 20s. And, I remember when I was at Columbia, being in the OR as a student and listening, the chair, Dr. Isaac, who's a very good friend of mine. I remember him always getting on whoever was assisting when they would slip their retractors, holding retraction, and just getting upset at them. Like, I need to hold it right here. So in my mind, it's like, okay, I'm going to do a good job and make sure I'm retracting well. Yeah. So Dr. Cabin can see what he's doing. So I remember this was like a 7-hour operation, which was standard for a double jaw surgery. And I was, privileged enough that he allowed me to retract for him. So we had these retractors, and I'm holding so he can do the operation. And I held it so well that he never once had to correct me. Yeah. But I was holding pretty strong. I was pulling on the tissue there. And he even commented afterwards, like, "Wow, you're just a third-year student. That was amazing, assisting and retracting." And they were very happy with me. Yeah. But I remember the next day we would do formal rounds. So we went in the hospital to check on the patient, and we looked at the kid. He was probably 17, and it was the most swollen I've ever seen anybody's face, and to this day. Yeah, it looked like a basketball. His face was so swollen, and Dr. Cabin came in to debrief with the team, the residents and chief, and I'm just a third-year student, and he was perplexed, like, surgery went great. I just can't understand why he's so swollen. And I remember my heart dropped. Yeah. Because I had this intuition at the time. I was like, it's probably me holding on.
Right, muscling it.
His muscles for 7 hours. Yes. And now I know that was true. Yeah. I told him that story probably like 20 years later.
Yeah.
And so I tell this to everybody, but it's true. It's like when we're doing surgery, you have to retract, you have to see the field, and there's trauma on tissues, and trauma for 7 hours is a lot different than trauma for an hour.
Right.
In terms of recovery.
Exactly. Exactly.
So it's not a race, but efficiency matters if you can do it safely.
Absolutely.
And in this case, even with more precision because of the technology we have.
Absolutely.
Yeah.
Yep.
So,
Well,
yeah.
Keep tooting your horn.
Yes, thank you. I appreciate it. I know we got to go, but people out there, you know, Collin and Rebecca, I know are going to be checking the comments and we'll answer questions. So any questions you guys have, reach out. If you need a good myofunctional therapist in the Utah area, reach out.
Yep. Breath Restored.
Breath Restore. Instagram handle?
Breath Restored Myofunctional Therapy. Yeah. My
You can do it
website
online
is
too.
breathrestored.com.
Okay. You guys look out for Rebecca. She has got unique perspective, not only a pioneer in Airway and a brave advocate for herself and her family, but also someone that can help you with myofunctional needs, or talk to your providers out there. And they'll be back, so we'll get them back on if you have a lot of questions for round 2. We'll see how they're doing. All right.
Well, thank you.
Best basketball player of all time. This is going to be interesting because we have Pacific Northwest, we have the Midwest.
I'm going to take a wild guess and say there's a proper answer to this question.
No, I want your answer. No bias here.
He's already done the surgery, so
Yeah, well,
you got nothing to risk now.
I don't know. I'm not really a basketball guy, but I guess I've heard Kobe Bryant's name more than just about anybody.
I like it. See, we're educating here.
Yeah, there you go.
All right. Make sure to like, subscribe, comment, share. Guys, thank you for coming back. I know you got to head to the airport.
Yeah. Well, thanks for having us. It was fun.
Yes, definitely.